livelihood. So the overall package was about $18 per person. After the intervention, so first of all, of course, we brought in what was supposed to be $60 per person per year to close the gap. Come to find out that actually only $50 got spent, so some things actually were not spent yet for all sorts of reasons. The community, remarkably, was able to do much more of its own investment, which doesn't surprise me because I'm in on the discussions with them all the time, but you do more things when there's somebody at the other end who says, if you do X, I will bring in the Y so that we can do the whole, finish the whole job. So the community has really upped the ante. Donors also were able to increase their investment. And remarkably and importantly, what of course we all worried about is, does our presence there, albeit no expats are doing any of the service, but does the presence of the project actually make the government, if anything, bow out of their role? And in fact, as you see, the government has actually, the project has leveraged the government's increased input into these communities. So that to me speaks to sustainability in that. And also, by the way, 2 of the sites in Nigeria, 2 of the clusters in Nigeria are about to be handed over to the government as of July 1st. The other component of sustainability I just want to briefly mention, we have a sister project called Millennium Cities Initiative run by Susie Blaustein, where there is a city within proximity of the Millennium Village, so it's usually not the capital other than Accra, but it's usually a secondary large city, and we have extensive project going on, working with the mayor and the metropolitan government, doing 2 sets of things. One is trying to figure out what sort of investment would be necessary to help make the city become attractive to foreign direct investment. What would the tax laws have to be? What would the infrastructure have to look like, etc. And then we also do needs assessment on the social sector, education and health. And the way that these Millennium Cities contribute to the sustainability of the rural areas, of course, that once the villages have been able to get out from being really hunger hotspots and no interaction to the markets, now that they actually, once they've done that transformation from that to being food secure and having a surplus, they now do have contact with the cities, and there is agribusiness, agro-processing, and a trade going on. And of course, the connection with the cities is an investment into sustainability. Just briefly, there are a couple of other scale-ups going on besides the fact that there are new Millennium Villages, such as the one in Haiti. But there, in India, we're doing 5 model districts in 5 different states on mainly health and education. The two most exciting things in Africa is that in Nigeria, I mentioned this last year, but now we're very much into it. Nigeria has decided to take this approach, having followed with us the progress of the communities in the 2 Millennium Villages sites in Nigeria. They have decided to scale it up to 20 million people, and it all hinges on what happens at this election. But it's incredibly exciting because in Nigeria, the scale-up would be funded by Nigerian funds on their own. So the Millennium Villages, so the Earth Institute, we're only adding ours, so we're working with them as technical advisors, but the funding and implementation, everything is done by the Nigerian government. And then there is a 6-country drylands initiative where we're working with these 6 countries where the drylands are incredibly problematic, where the water scarcity is so profound that it profoundly impacts on livelihoods, and so we're working on the Millennium Village type approach in these 6 countries, and it's supported by COMESA, the Common Market for East and Southern Africa. So it's very much a regional effort to benefit from doing things at scale. So this is my last slide. I just wanted to sort of summarize what I think is the necessary both science and implementation study which I call scale-upology. And I think it basically, I think there are 3 groups that need to get in gear. So one is, of course, the donors. We finally have to, in spite of all of the excuses and in spite of our own economic crisis, which, as Jeff was saying, is actually financier-induced, we really have to finally, after 35 years of promising to do so, we really have to make sure that the rich countries pony up with this incredibly small percentage of their rich world's, of our rich world's GNP, because it is the 0.7 that would all of the interventions that I talked to you about are within that envelope. We're very devoted to the multilateral funding mechanisms, like the Global Fund for AIDS, TB, and Malaria, which Jeff and Kofi Annan started, like the Global Agricultural and Food Program in the World Bank, which also Jeff helped start. These multilateral funding mechanisms are very important because what it does is it forces the governments, the recipient governments, to really do proper needs assessments and do it with all of the stakeholders and then present it to, like the Global Fund, for a technical review. So that what it does is it sort of eliminates the political will or the political won't. It really makes it so that the governments do a serious scientific-based needs assessment and that the donors do make the decisions based on scientific merit and implementability rather than on any other criteria. So those are the 2 things that are, of course, these funding mechanisms are finally being accepted. We need many more. We need an infrastructure fund, an education fund. But besides that, what's happening, of course, is that these funds are getting less rather than more money. Specifically, in this last budget, it had a woefully small amount, even though Obama promised 20 billion over 5 years. It only had 400 million, and it was just slashed down 2 days ago to 100 million. So basically, there is no funding for this. But that is the mechanism that would be quite transformative. The recipient countries, on the other hand, have to do their part, which is, 1, they have to do really solid needs assessment, which they have been discouraged to do by many years because the donors would say, no, don't be so ambitious. Don't actually tell us how many bed nets you would really need. Just tell us how many bed nets would be enough for this small area or to cover only children under 5. The recipient countries have to get away from that and really do honest scientific assessments, which fair enough, they can only do if they can be assured that there is counterpart scientifically vetted donor mechanism. And then the civic society, basically you and me. I think we also have our obligation. One is the universities, and I think it's slowly happening, really do start thinking more and more about sustainable development. Again, this scale-apology idea. At Columbia specifically, I just happen to know more because that's where I am. Jeff has started sustainable development program at the undergraduate level, master's level, PhD level, and we also have a global classroom where there's a master's in development practice, which is done globally with 20 universities all across the world, including Africa and China, where the students are learning together by a curriculum that is tethered together, where they also once a week speak to each other on a video conference. It's just altogether, I think, a high priority that universities do pay attention to the sustainable development in terms of learning and teaching policy implementation and management type curriculums. We're also, by the way, writing a manual on, for instance, the Millennium Village Project and how to manual. So I think universities have a big role. Then NGOs and other groups, such as are represented here, whether it's the Himalayan Cataract Project that we work with very closely, thanks to, by the way, Jennifer Stable-Clark, who introduced me to them 6 years ago, Unite for Sight, Partners in Health, numerous others. I mean, there are obviously hundreds, but we all play a very critical role by showing best practice what works in the field, what doesn't work, is hugely important and rich source of information that should be applied. I just wanted to alert you to one specific civic effort that we're spearheading as of about 4 weeks ago, which we call the 1 Million Community Health Worker Campaign, and accompanying Zero Mother-to-Child Transmission campaign. It's a campaign that the Earth Institute is launching along with our Millennium Promise NGO partnership, and it actually includes many organizations, UNFPA, UNAIDS, tons of these organizations, and more than I have here. We are trying to make a campaign that advocates for there being what there actually needs to be 1.2